Thank you, Don. It is great to be back in Louisiana. I think one of the best NEIC meetings that we ever had, at least in my experience, was one that we had just about 2 years ago in New Orleans. So I'm really happy to be back here. Let's see if I can get this to work. Okay. So what I'm going to do today is I'm going to go back, look at what we saw in 2013, last year, a little bit about what's going on now in 2014, and then also looking forward to 2016 and beyond, what we see coming a little further out with respect to the health insurance side of the Affordable Care Act implementation. The last year, as I'm sure all of you know, was a crazy year. It was a little bit of a roller coaster. We had a lot of last-minute guidance coming out of the federal government. For instance, the essential health benefits regulations that laid out exactly what has to be covered in each health insurance plan. That wasn't released until February 25th of last year, the final regulations. We had some inkling of what was going to be in it from the proposed regs, but it was really a last-minute adjustment, and plans had to be filed later that spring, so the carriers had to scramble to get those plans put together and priced, and then submitted to the state insurance departments so that they could review them and get those recommendations as to what would actually be sold on the exchange to the federal government in the case of the federally facilitated exchange states, and to the states in the state exchanges where the state's running the exchange itself. Because of that compressed time frame, you had a whole year's worth of policy review by the departments of insurance crammed into just a couple of months. So it was really a big uphill struggle for a lot of state insurance departments to get all that work done by late summer, by August. So those plans could finally be loaded on the exchanges and made available for sale when the open enrollment period rolled around on October 1st. Well, in addition to all that, we had the cancellations, as you all recall, where all of the, a lot of the carriers in the individual market canceled plans that would not be returning because they didn't comply with the Affordable Care Act. In some cases, that was done prior to January 1st, when those plans would no longer be able to be renewed. And then we were dealt with the transitional relief policy that took place later on. And on top of all of that, the states were engaged in a lot of outreach and education, helping to make sure that the consumers in their states understood their rights, understood their responsibilities under the new health reform law, and understood all the new structures going into place. So, fast forward to, thank you. Fast forward to September, end of September. We were ready to go. The plans were loaded on the exchange. Ready to start open enrollment on October 31st, and I'm sorry, on October 1st. October 1st rolled around, and I think we all know what happened. October 1st, open enrollment starts, and the system froze for the federal government, froze for a number of states as well. Unfortunately, consumers had trouble getting eligibility determinations. A lot of agents and brokers had a lot of trouble interacting with the exchange, getting credit for assistance that they provided to consumers. Turned out the back-end systems, many of them hadn't yet been built. These are systems that help reconcile enrollment between the carriers and the federal government, so both parties know who's enrolled in what plans, so that consumers can get their ID cards and can actually access that insurance and make use of it. In response to some of this, we had the transitional relief policy come out of the federal government. This happened in November. After open enrollment was well underway, the administration said that if you were enrolled in a plan, you could continue renewing that plan through October of 2014, this coming October, and then that plan could run through late 2015. There's a lot of concern among a lot of regulators about what this would do to the risk pools. If those people are given the opportunity to stay in those plans, the people who are currently advantaged by those plans, the rules that govern those plans, are likely to stay in them, where the people who will benefit from the new plans in the exchanges are likely to jump into those, creating a potential for adverse selection. So this has been a big concern to the state regulators. But they eventually got at least the front end of the system built, and we're back to happy land here, at least provisionally. And I think the results have been, hard not to say it's pretty impressive. Over 8 million people enrolled in the exchanges this past year, and more continuing to be enrolled through the special enrollment periods. And it looks like 80 to 90% of those individuals have paid those premiums going forward. About 35%, it looks like, of those individuals who are enrolled in the exchange plans are under age 35. As Donna said, 28% of those between the ages of 18 and 35, so you have some children in there as well. But this is going to be something that we need to watch going forward. Now, as a result of this and the Medicaid expansion and some other coverage expansions that have taken place, according to a recent poll by Gallup that Donna mentioned earlier, the uninsurance rate looks like it is now around 13.4% in April, which is a very significant reduction from where it was just a few months ago. So those are all good things. But we still don't know exactly what is going on under the hood, where all these coverage transitions are taking place, although we're starting to get some clues. The RAND Corporation recently released a study of changes in coverage between September of 2013, when the open enrollment period started, and today. This actually ran through late March, so the open enrollment period was still going on. Now, just a word of caution here, this is a pretty small sample size, about 2,500 people nationally, so there's probably going to be some significant error built in there, and as I said, it was going on during the open enrollment period, so it didn't capture all of the enrollment that took place during open enrollment, but we are expecting an update from them pretty shortly, which should give us some more up-to-date numbers here. There are about 199 million adults between the ages of 18 and 64, which is who this survey was looking at. And in 2013, in September of 2013, about 108 million, 109 million of those people had coverage through their employer-sponsored coverage. Another 20 million or 27 million had coverage through some other source. This would be various forms of government coverage, Medicare, Medicaid, dual eligibles, VA, military coverage. You had 12.3 million in Medicaid, which is the green bar there, and then another 9.4 million in the individual insurance market. That big gray stack to the right is the uninsured. That was 40.7 million people at the beginning of the open enrollment period. So what happened to these people? Well, most of them stayed where they were in their current coverage. But we did have some transitions. So interestingly enough, the employer-sponsored insurance grew significantly, which is the opposite of what some people had predicted we were going to see under the Affordable Care Act. You got another probably close to 8 million, 9 million people in employer-sponsored insurance. We're not really sure exactly why this is yet, but there was some expansion of employment during this period. And then also you have a woodwork effect of the individual mandate, which is consistent with what we saw in the state of Massachusetts when they put theirs into place. Employers offer coverage because it's valuable to employees and helps them attract employees, and because there's an individual mandate, it just got even more valuable. So you had more take-up of that coverage, and then also you had more employers offering as well. And then the uninsured, significant number of those uninsured ended up in employer-sponsored coverage. You'll see the numbers of the uninsured went down by about 9 million people. And then you had, in this survey, 3.9 million adults in health insurance exchanges, most of them coming from other coverage of some sort. In some cases, retiree coverage is also included in that category. And then about 1 million from both the ranks of the uninsured and from people who had previously been in the individual market. So this is just a very preliminary glimpse as to what might be going on under the hood. We're going to have to wait for more reliable numbers down the line, but that usually takes about 2 years to really get some of that administrative data in the large federal government surveys. So we'll probably see those sometime 2015, 2016 to get a lot more detailed and reliable numbers in order to get some pressing healthcare needs taken care of. And once they do that, then they'll let those premiums lapse and let that coverage lapse. How many of these people have pre-existing conditions? We know that about 35% of them are in that young are under the age of 34, and those people generally have lower healthcare costs. But the question is whether the individuals who have enrolled in coverage are representative of that larger trend among people in their age group, or whether they are disproportionately sicker young individuals or individuals who are expecting to become pregnant in the near future. So just what will the utilization be for those newly enrolled individuals is something that we don't know. There's not good data, and there won't be for some time. Who's going to take advantage of the special enrollment periods that are coming? And it seems like almost every week there's a new special enrollment period announced by the federal government for the exchanges. And what are those numbers in each state? We are always telling people in Washington every state is different, and I think this is a case where every state is different, and we're going to have to see how that shakes out, because these are state-by-state risk pools, not a large national risk pool. So the national numbers only tell you so much. And then breaking it down even further, what is the experience of each carrier? Do some carriers attract more risk than others? This is all going to shake out in the rate filings that we are going to see starting to come in the next couple of months. But even then, the data is pretty limited as to what we have right now, because you only have a couple of months to go on. How about premiums? Well, I can tell you this: premiums will go up. Premiums have always gone up. They will continue to go up. The question is, how much will they go up and why? One issue, again, this demographics. What does this enrolled population look like? Not just in the exchange, but also in the individual market outside the exchange, which the exchange is all pooled together with in the single risk pool. What is the influence of grandfathered plans and the transitional plans? These are plans that exist outside of the single risk pool. So if you have a lot of young, healthy people staying in grandfathered and transitional plans, then that's going to impact who's left in the risk pool for the exchange and the individual market, and potentially driving up costs. That's something we're looking at very closely. We probably won't have real good numbers on that until early next year sometime, when some of those filings start to come into the federal government, but states may be requesting that information on their own. Obviously, the market rules are going to have an impact on premiums. Anytime you compress rates through community rating, through the age bands that we have going into place, it's going to impact rates, and it's going to impact rates for some people differently than others. And this is all going to shake out over the next. It's going to take longer than just this year. It'll take a couple of years probably for us to get a real sense as to what's going on there. The premium taxes. There's a premium tax going into place on the federal side that's going to amount to somewhere between 1.5% and 2% of premium probably. That's ultimately going to find its way into the premiums that consumers pay. And then that escalates over time under the ACA. For the next several years, it increases and then goes with an inflationary index. what are the administrative costs going to be? There's a lot of new regulations going into place. Those have to be complied with. There's new reporting that has to be carried out by the insurers. That all has to be paid for, and it has to be paid for within the context of the medical loss ratio that restricts their administrative costs to 20% of premium, or in the large group market, 15% of premium. And along the same veins, the enrollment and payment issues that we saw during the open enrollment period. There were a lot of manual workarounds that insurance companies had to engage in that open enrollment period to make sure people got in their plans, to make sure that they're getting the right subsidies from the federal government, and all that takes increased resources from the insurance company. That also is going to find its way into the premiums. How much is that going to be? We don't know yet, but I guarantee we're going to find out. And then the risk mitigation programs. Congress foresaw some of these issues when they passed the law, so they put a couple of programs into place. The risk adjustment to prevent any one carrier from getting a disproportionate share of the healthy risk or a disproportionate share of the sick risk, and evens that out a little bit. A reinsurance program to subsidize the individual market during this transitional period, and then a risk corridor program that basically caps gains and losses for the first couple of years in order to give insurers a little more comfort in their pricing, given the lack of data that we have on the health condition of the people who are entering the individual market now under the new rules. So these are all things that are going to shake out. Some of it will be reflected in the rate filings that are going to be coming in just a couple of months, or in some states have already started coming in based on just a couple of months of data, and that's going to be something that we're going to keep our eye on. So looking forward, what do we see coming in 2015? Well, we've got the plan management cycle for the 2015 plan year. Seems like we just finished, and we did just finish, with the 2014 open enrollment, and state insurance departments are already accepting filings for 2015. Again, based on just a few months of data in terms of what's going on in the marketplace. There's some new rules going into place for qualified health plans that I'll get to, as well as new functionality in the shop exchange, the employee choice, which was postponed for a year. You've got changes in the employer mandate, that beginning to phase in, as well as changes in the individual mandate penalties and the reinsurance program that's a backstop for the individual market. And of course, more court cases coming down the pipe, probably headed to the Supreme Court. And in November, we've got an election coming up. How's that going to impact things? As far as the 2015 plan year filings, in May and June, most of the states are setting their timelines for those plans to be submitted to the State Department of Insurance so they can review them to make sure they're in compliance with all aspects of state law. Those are rate filings and form filings. And then on August 8th, you've got the first transfer of plan information from the state system, the SURF system, up to the federal data system. And this is the timeline has changed a little bit from last year. We've got about 45 extra days for the review process in 2014 for the 2015 plan year than we did last year. And this is a really good thing because we had a number of issues last year with the data about plans that was displayed on the federally facilitated exchange. In some cases, the data that was shown to consumers on the exchange did not match what the state had already approved and what the policy actually was. And this was discovered after the fact because there was limited time available to go back and make sure that those all matched up. So we've got additional time this year to make sure that what's being presented on the exchange actually matches what was submitted by the carrier and approved by the state for sale. So you don't have to go back and try and figure out what you're going to do for someone who bought a plan that they thought had no deductible when it turns out it had a $6,000 deductible, and realized that when they started trying to file claims. That was a real problem in some states that we're still working through in a number of cases. So on October 8th, you'll have that first transfer to HHS. They will take that plan information and put it on a portal so that the carriers and the state regulators can see exactly what the consumers are going to see when the next open enrollment period rolls around. The review process will still be underway in a lot of states at this point, and you'll have to go back and they'll have to go back and reconcile all the changes with what's been submitted. That final transfer for what's actually going to be sold will happen in September. HHS will be reviewing that over September and October. States and insurers will be looking at the plan information that's going to be shown to consumers, making sure it matches with what was finally decided upon. And then beginning of November, the carriers sign their agreements with a federally facilitated exchange. It all goes live on November 15th for the next open enrollment period, which will run through February 15th of 2015. So we've got kind of another uphill battle ahead of us in terms of these plan reviews. Not as bad as last year, because last year we had essentially every plan being refiled and had to be reviewed over that compressed time period. This year we'll have rate filings, and you'll have some plan changes that go into place, but I don't think it will be nearly as extensive as it was last year. At least that's what we're hoping. Now, the changes that go into place for 2015 generally center around network adequacy, and there's been a lot of talk in the press about network adequacy and the narrow networks that we're seeing in some of the exchange plans, in a lot of the exchange plans, and HHS certainly saw those news articles as well. For next year, they're going to be collecting plan lists from all carriers, provider lists from all carriers of exactly who is in their network, and they're going to begin analyzing that using a reasonable access standards in the handful of states where they are conducting those reviews. However, they're going to take that experience from reviewing those provider lists this year, and they may use that in future rulemaking. And this is something that's of a lot of concern to a lot of states, because again, every state is different. Every state has different provider availability issues. Every state has different geographical issues. You've got rural states, you've got very urbanized states, and so a single standard coming out of Washington, D.C. on network adequacy is something that makes a lot of folks, particularly rural states, very nervous. The NAIC is starting to look at this as well. We have a model law dealing with network adequacy that we're just in the process of opening up and looking to see if there are changes that need to be made. It may end up providing a series of options so that states can choose and customize that standard to meet what they need given the underlying fundamentals in the state market. Then the essential community providers requirement. Last year, the carriers were required to provide, to include 20% of the essential community providers. These are federally qualified health centers and other providers in medically underserved areas. This year, that's going up to 30%. HHS doesn't think this is going to have a huge impact on plans because they think most plans pretty easily met the 20%. But again, we'll wait and see what actually happens. One of the aspects of the Affordable Care Act that was, I think, concerning to a lot of states was the employee choice provision. And this is something that was delayed a year because the federal government couldn't get the systems built. And they're not alone. Massachusetts included employee choice in their health reform law, after which the Affordable Care Act is patterned, and they never could figure out how to make employee choice work. There are a number of states that have been able to make it work in 2014 in various ways, but we're going to see how the federal government does it in 2015. That's going to be something that we need to keep our eye on. And you've got the 4 levels of coverage in the SHOP exchange, and today an employer is choosing a plan for all of their employees, and that's the plan that they can enroll in or not enroll in. Well, beginning in 2014, an employer will be able to choose one of these tiers, say the silver tier, and each individual employee may choose a different plan within that tier. It may be from any carrier on that plan, and each individual will be rated individually based on their age, their tobacco use, their family composition, and then also what plan they chose. So you're going to have a different premium amount for each employee. The exchange then has to aggregate all of those and send them out to each individual insurer. They have to send the right amount to each insurer and get all of that coordination working. Given the issues that we saw last year with just the individual market exchange, which is much less involved than the employee choice model, this is something that I think has a lot of states and a lot of carriers very nervous. In recent regulations and guidance that HHS has put out, they're going to let the states, each state, make a recommendation to HHS by the beginning of June as to whether or not this is going to increase costs in their small group market, and if so, the state may opt to put off employee choice for another year until we see exactly how this works. And I think this is something you may see a lot of states take advantage of, but it's something they're going to have to do in short order here in the next couple of weeks. We also have the employer mandate starting to go into effect. As you all know, this is something that was postponed in 2014 due to the employer reporting requirements that would go along with that, and they're phasing it in 2015. So small employers, large employers rather, those with 51 to 100 employees will not have to comply in 2015, and the larger employers will have to offer coverage to 70% of their eligible employees. And then in 2016, it becomes fully phased in, and that threshold is 95% of employees in both the small group and the large group market.